welcome back to another video with your girl Sammy. I hope we all are doing fine, feeling great. In this video we will talk about hypertension, otherwise known as high blood pressure. So my awesome viewers, what do you think hypertension is? Hypertension, also referred to as high blood pressure, it is the force of blood flowing through your blood vessels and is consistently too high. Your blood pressure measurement takes into account how much blood is flowing through your blood vessels and the amount of resistance the blood meets while the heart is pumping. So guys, there are two main types of blood pressure. The first one is called primary or essential high blood pressure. This type is the most common of the two and is developed over the years. Then you have secondary high blood pressure. This type is caused by an underlying condition. It tends to appear suddenly and give a higher blood pressure reading than the primary hypertension. Now guys, early detection is very important. Regular blood pressure reading can help you and your doctor notice if your blood pressure is elevated, but just one reading isn't enough for you to be diagnosed. So your doctor would have to check your blood pressure over a few weeks to see if it's still elevated or returned to normal levels. If it is consistently above normal, it may result in a diagnosis of high blood pressure. So guys, blood pressure is measured using two numbers. The first one called systolic blood pressure. This measures the pressure in your arteries when your heart beats. The second one is called diastolic blood pressure. This measures the pressure in your arteries when your heart rests between beats. What are normal blood pressure numbers? Have anyone been told your pressure is too high or too low? Let's find out. So guys, take a look at this chart where you have blood pressure category. You have systolic, which is the upper number. You have diastolic, which is the lower number. And under normal, for systolic number, you have less than 120. And under diastolic, you have less than 80. Look at the elevated one. So for this one, under the systolic, it's 120 to 129, and under the diastolic, it's less than 80. Now, the high blood pressure. Systolic 130 to 139, and diastolic 80 to 89. High blood pressure, which is the stage 2 now, 140 or higher or 90 or higher under the diastolic. Now guys, look at this one in the red. Hypertensive crisis. Under the systolic, you have higher than 180, and under the diastolic, it's higher than 120. That's very, 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 very high. Now guys, moving on. The higher your blood pressure levels, the more risk you are for other health problems, such as heart disease, heart attack, and strokes. High blood pressure do not have any sign or symptoms unless it starts to affect your organs. So guys, have you ever wondered why sometimes your blood pressure reading is too high or too low? Let's find out some things that affect the systolic and the diastolic pressure. Your systolic pressure is affected by a variety of factors, such as anxiety, caffeine consumption, and performing resistance and cardiovascular exercises. These factors cause a temporary increase in systolic pressure. On the other hand, your diastolic blood pressure is affected by a variety of factors. Some are uncontrollable while some can be controlled. For example, biological sex, family history, anxiety, and poor diet, just to name a few. Guys, let's take a look on the screen for some more possible cause of high blood pressure.